And broadcasting now. Welcome everybody. I can see the attendees flooding into the webinar. The numbers are rapidly increasing, so a warm welcome to everybody. I will wait a few more seconds as we have quite a few hundred people registered. So I shall just wait until we've got a few more attendees in. There's still some seats at the front. If you move, the front row is still empty. As always with lecture rooms, the front row is nearly always empty. Awesome. We've got loads of people coming in. I will make a start. My name is Wendy Nevins. I am currently Senior Vice President of the BVNA, and I'm here just to give you a very warm welcome to this webinar, just to give you a few tips to make the best out of your webinar experience this evening, and then I will mute myself and hand over to the people that you're actually wanting to hear from tonight. So if you're connected on wired internet, sometimes you can get audio disturbances. We've also had reports of some internet providers having outages today. So if you're having audio problems, it may be due to your internet connection. There is the option to dial in on the telephone. To dial in on the telephone, you'll be able to see a black toolbar on your screen, either at the bottom or the top. And along that toolbar is a little microphone symbol with a little up arrow. If you click that up arrow, you can join on the phone. You'll be given a telephone number, a meeting ID, and a participant ID. So if necessary, you can get a better experience by dialing in on the phone for the audio. I will be trying to stream this live into Facebook as well. So we will be on social media live, fingers crossed as well. If you have any questions, either any technical questions for your experience for the webinar or any questions for our speaker, then do please type them into the chat box, which should be available again on your black toolbar chat. You should be able to just pop chat. We've had some comments in. Oh, someone found my joke funny. They put ha ha. Awesome. And we've had some hellos, so everyone can hear us. So I will disappear into the background and try and keep the tech running and hand over to Alex, who will be able to take over and introduce the speaker. Over to you, Alex.
Thanks, Wendy. Hi, everyone, and welcome to what I believe is the 4th COVID-19 support webinar brought to you by the BVNA. So, here we go. Oh, there we go. Right, so I'll just run through the agenda for this webinar. We're going to start with an update from me on what's been happening with COVID-19 over the last week. And then I'll hand over to our fantastic speaker, Amanda Curtis, who is a registered veterinary nurse. And Amanda is going to be talking about coronavirus and disinfectant protocols that can be used to ensure effective disinfection of high-risk areas to help maintain practice hygiene standards and prevent contamination. Amanda's then going to be talking about infection control and training staff with infection control and how to maintain those standards. And then we'll finish this webinar with a question and answer session at the end. Okay. So if we have a look at the first update slide, these numbers are actually only updated yesterday. And currently in the UK, we have 226,463 positive cases of COVID-19. We also have 32,692 COVID-associated UK deaths. If you want the most up-to-date information, feel free to check the NHS advice and Government UK coronavirus websites as regularly as you would like. So let's have a look at the current government advice. Some of this is still the same as it has been in recent weeks, but there have been some new developments. So if you have coronavirus symptoms, such as a high temperature or a new and continuous cough, then you must stay at home for 7 days. Only call NHS 111 if your condition worsens or does not improve after 7 days. And if members of your household have symptoms of coronavirus, you should stay at home and self-isolate for 14 days from the day the first person got the symptoms. But there have been some new developments with the government's advice, and these stand as follows. The government have advised that we stay alert, and this means you must stay at home as much as possible, work from home if you can, limit contact with other people, keep your distance if you go out, so still adhering to those strict social distancing guidelines, so 2 meters apart, wash your hands regularly, and do not leave your home if you or anyone in your household has symptoms. So we're still being really cautious, and it's really important to stick to those government guidelines. So looking at the impact on veterinary practices, the RCVS guidelines are there to ensure that animal welfare is upheld whilst protecting the veterinary team. There's still a reduction in the number of staff operating in practice. However, the government furlough scheme is currently continuing now until October 2020. Social distancing measures should still be in place to minimise face-to-face interaction with clients. And we're also offering or advised to offer remote services, so telemedicine to clients, where we're using technology where it's appropriate to reduce further contact with clients. However, practices are asked to make a risk assessment for each individual case. There are also some new government guidelines that provide a framework for different veterinary practices to build on, but these are not specific to the veterinary sector. So there's some guidelines out there for those working in, for instance, retail or offices. And some of these guidelines, or many of these guidelines, will be applicable to those working in practice, but there's nothing specifically there for the veterinary sector. And it is still very much not business as usual. So I'm going to pass you over to our brilliant speaker for this evening, which is Amanda Curtis. I'm going to just tell you a little bit about her first. So Amanda qualified in 2012. She's worked in a variety of settings, including work at the Queen Mother Hospital at the Royal Veterinary College as an emergency and critical care nurse. Amanda has a keen interest in wound management, ECC and infection control, and has previously undertaken the BVNA Delving Deeper into Wounds certificate. Amanda is also a part of the editorial board for the Veterinary Nurse Journal and has published several articles. More recently, Amanda joined the BVNA as a regional representative for the South West Wales region, which is great. And Amanda also peer reviews the Vet Nursing Journal. So without further ado, I'll hand you over to Amanda for this evening's webinar. Please feel free to add any questions or ask any questions using the chat box or via Facebook Live if you're watching that way, and we'll endeavour to answer those questions at the end of the webinar. So I'm just going to pass you over to Amanda now. Hopefully this will work. Here we go.
Wonderful, lovely. Thank you very much, Alex and Wendy, for that lovely warm welcome, and welcome everybody, and thank you for joining us tonight. So I'm going to start off by kind of talking about a little bit broadly of what viruses actually are, and then kind of more specifically what a coronavirus is and what makes it kind of what it is really. So viruses are really small microbes. They're the smallest sort of bacteria and fungi, and unlike other infectious agents, they actually need a host cell to replicate. So while they're in the environment, they're actually dormant. In this state, they're actually known as virions, and they don't actually become an active virus until they invade a host cell. So they actually consist of a protein cell known as a caspid. I like to kind of think of it as a kind of like a little container, which actually holds all of the virus's genetic material. So generally most viruses will either be RNA based or they'll be DNA based. So the coronavirus family is actually an RNA virus. So this specifically gives them the ability to quite rapidly mutate. So there are obviously quite a lot of coronaviruses within veterinary and human sectors that we need to think about. And so today we're going to be concentrating on COVID-19, but it's just to highlight that you want to be careful when you are talking to owners and other people about just coronaviruses in general, that you're not kind of confusing them by calling, you know, a specific veterinary coronavirus just as a coronavirus. Like I say, you want to be a bit more specific. So as I said, the RNA aspect of the virus allows it to mutate and evolve rapidly. This is actually due to the way RNA actually translates. So it's not very good at proofreading itself when it makes new genomes. So as it keeps replicating, the more it does this, the higher the chance you've got of mutations happening, which is the reason, part of the reasoning anyway, behind a lot of the social distancing is as you get a higher population, as you get higher numbers within the population that become infected, you've obviously got a lot more of that virus that's being replicated constantly. So you've got a lot more of a chance of creating mutations, which has actually led to us having quite a few different strains across different countries. It's why it's sort of causing us quite a lot of problems as well in researching it and actually dealing with the infectivity of the virus. The other aspect then to coronaviruses is actually it has a lipid envelope. So you may find that some viruses are enveloped and some are non-enveloped. So it actually works in our benefit that these viruses have got this lipid layer surrounding them. As much as it's important for their infectivity, it actually makes them really fragile just because of how easy it is to break down lipids. So this is why again, with hand washing has been made so prevalent now, just because it actually is a really effective way of breaking down that virus's lipid layer. And it also makes it really susceptible to the majority of detergents and disinfectants. And then finally, they actually have this outer protein shell. This is what actually caused the coronaviruses to be named as they are. So when they were first looked at and seen by the sort of first microbiologists, they noted that it was almost crown-like, or like as it's described as a corona. So that can either mean that it's crown-like, or it can also mean like it looks like a sun basically. So as you would sort of find that kids draw suns with the sort of spikes coming out around it. So that's why it's actually named a coronavirus. So transmission routes. So the main primary way that they believe COVID-19 is spread is through direct transmission of respiratory droplets. So there is a difference between the virus being classed as respiratory droplet transmission and it going through being airborne. So the main difference here is actually the size of the droplets that the virus is contained in when it's expelled. So a respiratory droplet is classified as greater than 5 microns, whereas in airborne viruses, they're in what are called these nuclei droplets, which are a lot smaller. So it actually allows them to stay and float up and around in the air. Whereas with the respiratory droplets, because they tend to be heavier, heavier than most molecules found in air, when people are expelling them, so when they're coughing and sneezing, these droplets which have got, which are contaminated with virus, then expel out, float out, and then they land down on surfaces, which is where they can then be picked up on people's hands, picked up on clothing. People are then wiping their faces, which is actually really difficult not to do. I don't know how much of you have found that actually it's really difficult not to touch your face now. We've all been told not to do it so often. So yeah, these droplets then can get in through your mucosa. So that goes in through your mouth, through your nose, or through the conjunctiva of the eyes. The other way as well is being in close proximity to somebody infected. So if they are sneezing or coughing and you are in close proximity to them, initially there was a rule of 1 meter, but that's obviously now extended to 2 meters, which is what we're doing through social distancing rules. Any closer than that, you are at a higher risk of picking up those respiratory droplets and basically getting them into your body. There is some evidence that COVID-19 can survive on surfaces, potentially up to a few hours. In certain conditions, you could potentially be looking actually that these viral proteins can be surviving for days in droplets. So certain surfaces and certain conditions, it can be up to a week. So it is just something to be aware of when you're handling things in practice, when you're handling objects like leads, surfaces, things like that, just to be aware that that's why we need these really good infection control protocols, is just to try and help reduce this risk of contamination and just kind of stop these transmission routes before it carries on spreading. So when we look at fomites and contamination, so a fomite is typically looked at as an inanimate object. So these act as a transmission route for microbes between hosts. So as I've said, somebody with contamination on their hands touches something, it doesn't get cleaned effectively afterwards, somebody else comes along and touches that, they've then picked up those infectious agents on their hands, and it will continue to spread that way. So there's actually minimal evidence at this point that pets pose a potential risk for transmission, but I have included them here as potential fomites, just because I think we do need to be aware of it, and we do need to consider that there could be a potential chance for them to be carrying viral proteins in and around with them and into the practice, more so on things like their leads, on cat baskets. So these we should be looking really at swapping when we can. So if you're transporting a dog into the practice, trying at the earliest, safest point that you can, transferring them onto a practice lead that can then be laundered afterwards. Cat boxes, I know this is probably a little bit more tricky. You're wanting to try, if you can, to transfer those cats being brought in into, again, a pre-cleaned practice basket. If that's not available or that's not an option, then just wiping down that basket and removing any potential contaminants before you then go and look at handling that cat and further sort of examinations and things, or before taking it further into the practice. Next then is to just consider removing really unnecessary equipment that you've got hanging around. It'd be a really good time to maybe think about having a really good clear out. There's going to be minimal staff on at the moment because obviously we aren't business as usual. We've got people furloughed, we've got changes in people's schedules, so you might find you've got rooms or equipment or things that just aren't generally being used as much as they would normally. So it might be something to consider, just having a good declutter, getting rid of things that are collecting dust and just causing extra cleaning that you don't really need to be worrying about at the moment. So you want to be generally minimizing contact areas. So unused office space, spare consult rooms, give them a clean down and just close them off, and just mark it for people so that they know that this room's been cleaned. Try not to use it if possible. And then maybe consider as well some single-use items. Can these be effectively cleaned after they've been used? If you don't think you can effectively clean something after you've used it, that is a potential fomite. It's got the potential to cause further contamination, and it might be that you kind of need to consider disposing of it. Okay. So moving on. So what actually is the definitions of cleaning and disinfecting? So just because you look at something and it looks clean, it doesn't necessarily mean that it's been efficiently disinfected. So when we're looking at cleaning, we're looking at removing any of that sort of physical debris, any kind of inorganic, organic material that we can actually physically see. So we're actually looking to remove that from a surface or the environment or off equipment. And that's basically helping us just stop these sort of microbes and pathogens in their path. So we're stopping proliferation, we're stopping them spreading further. So visual cleanliness, so like this removal of everything, is achieved through the use of cleaning equipment. So that can be detergents, and then using mechanical friction. So you're actually physically wiping it or sweeping it or just generally removing it before then you look at then going on to disinfecting a surface. It's something to bear in mind that certain disinfectants, that we'll talk about a little bit later on in a few other slides, that certain disinfectants will actually not be effective if you haven't physically cleaned that surface first. So when we're disinfecting, our aim is to actually inactivate or completely destroy any pathogenic material that's on a surface or on equipment or in the environment in general. So they actually work by destroying, or the majority of disinfectants work by destroying the microbe cell walls. So they do break them down, and then as they're broken down, you should be able to just physically wipe them away then and get rid of them. They should be inactivated. So it's these two factors together that ensure effective disinfection. And we can't just assume that because people know how to clean, that they know how to effectively disinfect. It's definitely a good role for us as nurses. We do tend to be the drivers of infection control within the practice setting. So it's something that we can really get behind and just help, people who are maybe in roles that they weren't necessarily in before, or having to do extra cleaning that they wouldn't have had to do before, or expected to do extra disinfection that they wouldn't have had to do before. And we can make them aware of how to actually do it. Because a lot of people will tend to use their nose for this. It is a known thing that you walk into a room and it smells really clean, so you assume that it's clean, and that's not always the case. It can almost create a bit of a false sense of security, that because it smells clean, that it is clean. Okay. So when we're looking at disinfection as a whole, where do we want to start? What do we want? What are our goals? What are our aims? So what can help us to get to and ensure that we're doing effective disinfection? So selecting what kind of disinfectant that you want and what kind of properties you want in that disinfectant can be a nice place to start. So the selection process of your disinfectants is going to vary depending on what it is that you're wanting to do. So where are you wanting to disinfect? Is it a surface? Is it a whole room? Are you looking at removing potential airborne pathogens? Are you looking just to clean a surface? Are you looking at skin disinfection? Are you looking at cleaning and disinfecting certain types of equipment? All of these factors are going to change what potential product that you pick. There isn't going to be, unfortunately, a product that suits every job. So when we're kind of considering our disinfectants, we want it to be broad spectrum. We want it to cover a wide variety of bacteria, viruses, spores, all those sorts of things. We also want a rapid onset of action. We don't want to be cleaning something and leaving it for 30, 40 minutes before we can use it again, especially certain surfaces anyway. There might be some equipment that it's not so much of a problem that it's not a rapid onset of action, but certain things like, say, our tables, kennels, things that we've got quite a high turnover with patients coming through, we don't want to be waiting around for that. We also want to have a relatively stable solution. So once that concentrated product is made up into solution, we want to know that it's stable, and we want to know that it's stable for a relatively good amount of time. We don't want to be changing that solution every 24 hours, because then it's not going to be cost effective. It comes under ease of use then as well. That's not going to be easy to use, because you have to remember to constantly change it. You have to know when it was last changed. So we need these things to be really easy to use. And we also want them to be safe, not just for ourselves, but also for our patients. So we need to know that these are relatively non-toxic to all types of animals coming through the clinic. And cost and availability is going to come into that as well. And that's going to depend on your practice and what you have available to yourselves and funding. So this table is just going to run through quickly. This is by no means an exhaustive list of disinfectants. There are obviously a lot more out there and on the market, and there are all sorts of different ones that come under all of these categories. And I'm not going to run through this too in depth, just because I think I'm probably going to run out of time for everything else otherwise. So it's just, again, it's just to highlight, when you're thinking about your disinfectants, think about how they work. You know, what are the advantages and disadvantages of different disinfectants that are available on the veterinary market? You know, majority of our veterinary available disinfectants are going to be effective against COVID-19. Again, because of this lipid envelope that it has, it does make it more susceptible. So it's not too much of a stress that you need to go out and change all of your disinfectants that you've got. There's no worry with that. And to actually be in line with the virucidal, I believe it's the EN 14675 standards, which are set by the European Chemical Agency. For a disinfectant to follow those standards, they need to actually be able to kill non-enveloped viruses which have a higher resistance to chemical, physical and environmental influences. So most of our veterinary disinfectants are going to be more than enough than what we need for the actual job of what we're looking for them to do. So there are a few things I haven't listed here that might be handy. There is heat and steam. This could be effective if you've got fabrics that can't be laundered, so using something like that in work vans and cars. I might see a few questions we've already had come in today about transporting dogs. So if you're putting a dog in a car into a boot, then you can't take everything out and it's not easy to wipe down, it's not a plastic surface. You know, things like heat and steam could be a good option there. And then this should lead us on nicely to our high risk areas, basically. So as I've mentioned, there are all sorts of different factors that are going to affect what disinfectant we want to select and how often we use that disinfectant. So we need to consider in that these high risk areas, these high risk touch areas. So these are areas and places or equipment that a lot of multiple personnel throughout the day may be touching and handling at different times. So how can we be certain that the disinfectants that we're using are suitable? And that's going to come down to, well, what you're cleaning. You might find that certain disinfectants you need to take care with sort of mobile phones and tablets. There's a lot of places now, I know, practices that are using tablets in place of paper hospitalization charts. So, you know, you're not going to be wanting to use certain disinfectants on those because it could potentially damage them. It'd be worth checking with the manufacturer of those. I believe that most alcohol wipes are safe, but definitely do check with the manufacturers before you use anything on those. Things like your kennel handles, things that kind of get forgotten about sometimes, where somebody goes into a kennel, closes that door, goes off and washes their hands, but doesn't actually think about just giving that kennel handle a wipe after they've used it. Certain equipment we're going to want to clean more regularly than others. I'd say if you've got personalized equipment that only you are handling throughout your whole shift, like your pouch or your fob watch, your own stethoscopes, you could do those at the beginning or end of your beginning and end of the shift. So there's no need to be doing those potentially unless you've got a high risk patient and you've taken that equipment into an isolation, which more than likely you shouldn't be anyway. Then you would want to be cleaning it down between using it on patients. But other things like otoscopes, clippers, I would even push to say keyboards, you're going to be wanting to clean between uses. So once you're done and finished with an area, wiping down the table, wiping down all the equipment used, just giving those keyboards and things a wipe afterwards, and the phones, because again, they're going to be kind of risk areas where, especially with phones, people are putting them up to their faces. There's going to be a contamination risk there. And another thing just to appreciate is that these extended cleaning protocols are potentially going to take a little bit longer. We're not going to be doing just our usual typical cleans anymore. You know, we've obviously always, like I said before, been at the forefront of infection control within practice. But it's now, again, it's even more important, and it's more important to keep pushing that and pushing protocols and making sure that we've got written protocols that can help us to ensure that we're aiming to good high standards of infection control and biosecurity, which leads us on to staff training and cleaning protocols. So as I've mentioned previously, visual cleanliness can be really deceiving. So how can we make sure that, and especially now that we're in smaller teams and there's less people around, how do we make sure that everybody is getting on board and cleaning and disinfecting, effectively? So first off, you could look at, do you have standard operating procedures? Do you have SOPs in place? If you do, are these written down? Are they guidances or are they protocols, which there are a difference between? So guidelines tend to be more flexible. They tend to be just there for people to kind of have a look at and then kind of plan from there, you know, using their own initiative, whereas protocols are a little bit more set in stone. These are something that, you know, must be followed as per standards as they are written down. And having them accessible as well is also important. You don't want them in a folder in the back of an office somewhere where nobody's got, you know, nobody knows where they are, nobody's got quick access to them, because these can be a really handy prompt to ensure that staff are following these protocols, you know, so people can go and look at them and go, oh, am I keeping up to date? Am I doing that right? How should I be doing this? And next then you've got checklists. So these are a really fantastic, useful tool, and they're already, you know, used across a variety of areas. You know, in anaesthesia, they're becoming a bit more talked about. We use pain scores are essentially like a checklist. There's the IVC catheter checklist. You know, they're being implemented across a variety of areas, and these can really be effectively applied to infection control procedures and biosecurity. They, again, it's just another thing that can prompt everybody in the team to think, when was something last cleaned? These don't need to be complicated. These can be nice, really simple tick lists that somebody can just tick or initial just to say, do you know what, that's been done today? Or, oh, right, actually, no, nobody's gotten around to that. I better make sure that's done today as well. You know, it can be tailored to suit your practice. You know, you don't need to go online and copy these SOPs and these checklists and take them and enforce them on your practice. If they're not going to work for you, then people aren't going to stick to them. So it's really important to make sure that you're tailoring them to suit how your practice runs and the needs of your practice. And a way that you can maybe do that is to find somebody that does have a bit of a passion for infection control and put them up as an infection control advocate. You know, somebody that actually kind of monitors, but not in, it doesn't have to be in a forceful way. It can just be somebody who helps with staff training. They can just make sure that everybody does know what they're doing for starters, and then ensure that people are actually adhering to cleaning protocols and just prompting people to use the checklists. It can just help, especially if you, again, like we said earlier, you've got people that are working in situations which is completely out of the norm, things that we're not used to. So it can be really easy to forget about cleaning protocols and disinfection protocols and sticking to proper SOPs when, you know, you're already rushed off your feet because you're dealing with a lot more workload than you would have previously. But it is so important. It's something that really we can't be forgetting about. And then lastly, you know, you can use, there are a lot of nice hygiene monitoring kits now out there. So these can actually be used to help with auditing. So again, this follows on from checklists, and auditing can be a really useful tool to help create checklists and SOPs. I'm not necessarily saying that people need to go out and start doing hefty audits and auditing everything in their practice, especially while we're on limited staff. You know, we've got changes to schedules, there's people on furlough, so it probably isn't quite the time to be going head over heels for audits, but they can be something to look at in the future. You could use potentially this opportunity to look at areas and just make notes of things that maybe you feel like could warrant a little bit of improvement, or it might be you've highlighted a gap in training, and you could potentially use an audit, even retrospectively, to look back and go, well, during the time when everything was as it is now, we changed this protocol. Actually, how well did that work? How well is it going for us now? And look back at things. So it's something just to highlight and just to consider, and just have a bit of a mental note made about it. So this is just to kind of highlight how important staff training is, and where gaps can come in training. So these are 2 bottles of disinfectant that were made up by members of staff and put into consulting rooms. So I work nights, and I'd come round and I'd seen these, and obviously it's quite obvious that these have not been made up correctly. So this is a gap in training, and it is a staff training issue. And it's trying to figure out, like, why has this happened? It's coming back to not just going guns blazing and blaming this person and, you know, and saying, oh, well, they've done it wrong. It's actually looking at, well, why did they do it wrong? What don't they understand about infection control that's caused them to think that it's fine just to refill up this sort of bottle without checking the dilution rates? And a really simple way of maybe correcting this is sort of talking to that person and making sure they understand the importance of why a disinfectant needs to be made up to the correct dilution. You know, even highlighting sort of health issues that can come from incorrect dilution. You know, sometimes if you make it about a person's kind of health and the impact it'll have on them personally, then sometimes it can kind of make things click a little bit more. And things like this can be kind of simply corrected if you've got access to installing, you know, a lot of these places now do pre-calibrated pumps, which give you a calibrated dilution rate, which can help minimize errors. So again, this all just ties in again with the auditing and finding these areas in practice where maybe people are lacking in knowledge, and by no fault of their own, you know, they're not, you know, necessary. It could be sort of support staff, as in reception and things like this, where they haven't gone on the courses that we've been on, so they aren't formally trained. So it's just something to consider, that it's not always a lack of not wanting to do something correctly. Sometimes it's just the lack of knowledge. And when we are looking at putting in all of these kind of protocols and things, again, just make it individualized to your team, and make sure you discuss it with them. You know, really involving the team can be key to these kind of things. You're going to get resistance if you just throw out a load of protocols and just expect people to follow them. It's not the ideal way to do it. You know, infection control, it is a team sport. It's everybody's responsibility. Everybody needs to be involved to make it work properly. So just monitoring, reinforcing, and then when it eventually can come around to it, potentially looking at auditing then, and making sure you are doing everything as well as you can be. So coming down to my last slide. So this is just to highlight just some things to remember about disinfection. Okay, so just to again mention that being an envelope virus, it is easier to eliminate, which is great news. It's one of the few probably nice things to come out of this. At least it's not difficult for us to remove from the environment. So we do want to make sure that we're checking our dilution rates. I haven't put dilution rates to here because there are so many different available veterinary disinfectants available on the market that everybody's going to be using. I would just suggest that you ensure that you're checking the manufacturer's guidelines. So make sure you're using the appropriate dilution rate for wherever it is you're wanting to use it, whether you're using it for a piece of equipment, or you're using it for an isolation case, or if you're just using it to clean general surfaces. Just making sure that you're using the correct rates, because over diluting something and using a higher concentration rate, it's not going to give you an improved mode of action. It could actually do the opposite. It could actually be fairly harmful. And also being careful not to mix your different disinfectants and not mixing them with a detergent thinking that it's going to be fine, because it can actually inactivate certain disinfectants. Making sure that you're refreshing each time. So when you're cleaning floors, you're emptying those mop buckets and you're cleaning those mop heads. They're being laundered between use and fully dried when they're being stored as well. Again, all of these things are going to act as potential fomites. If we aren't looking after our cleaning equipment, then we're just looking at spreading further contamination across the practice, and maybe even considering making sure, if you haven't, that you've got separate cleaning equipment for separate areas. So you're not using the same mop bucket that's coming all the way through reception through to your prep or kennel areas. It's just, again, it's just minimizing cross-contamination as much as you can. And again, do be careful the way you're storing your cleaning equipment and cleaning it regularly. So you want to make sure that it is ideally cleaned between uses, and if not, at least just once a week. It's still, again, it's going to reduce that cross-contamination risk. And checking the shelf life of your disinfectant you're using. So there are certain disinfectants that over time can actually become inactivated. Bleach is one of them in particular, that actually, once it's made up into a solution, once it's diluted, it lasts approximately about 24 hours. So you are looking at changing that daily, and it needs to be applied more regularly than some others. Most of our quaternary ammonium compounds are generally good for about 6 weeks, but again, that might differ depending on the manufacturer and what product you're using. So it's just to make sure that you are using it correctly and you are changing it. And when we're changing it, you are completely emptying and refilling that bottle, because again, you may be mixing old solution with new solution, so you may not have an effective disinfectant solution. And to make sure that we're effectively cleaning before we're disinfecting. So you're moving that inorganic or organic material, you're removing all that debris before you go in there and start spraying on your disinfectant. You can't just spray a surface, leave it soak in and hope that that's going to do the job. Some debris can actually create a barrier which prevents effective penetration of the disinfectant. So it is really important. And some of these disinfectants are actually completely inactivated, again, like bleach. To an extent, our quocs are also mildly affected by material and debris. So it is, again, just thinking about what's going to make that disinfectant the most effective it can be. And we want to ensure that we're allowing enough contact time. So you want to be making sure, again, you're going to have to follow all your manufacturer's guidelines, making sure that you're following the correct contact times and ensuring full coverage of the area. So if you're cleaning a table, you're not just wiping the top of the surface, you're cleaning around the edges, you're cleaning the legs, and it is time consuming. Nobody's perfect, but it's one of those things we do need to take the time for, just because, again, this is something we're trying to minimize the environmental contamination as much as we can. And again, just to reiterate that we're making sure the whole team is trained in biosecurity and infection control and prevention. So what we don't want is massive gaps in training where things aren't being effectively disinfected between use, and that we're causing contamination issues. And to make sure, if you are implementing and you do have SOPs and checklists, that they're written down and they're easy and accessible for everybody. And, at some point, maybe consider doing some auditing regularly. Okay, well, thank you very much, everyone, for listening. I don't know how much I run over then, hopefully not too much. So just to mention for Wednesday the 27th, so you probably noticed today I actually haven't been through anything to do with hand hygiene and handling of our patients. So that is going to be covered in a follow-up webinar by myself. So that's on the coronavirus and the veterinary team, and how we can protect ourselves and others around us. So I'm going to be covering why hand hygiene is so important, how to perform effective hand hygiene, when we should be washing our hands, should we be using gels, shouldn't we, personal protective equipment, and just also as well the hospitalizing patients from potential COVID households, and a little bit on nursing considerations. And there are just some links there if anybody is interested in looking at auditing a practice, or looking a bit more into infection control procedures over these sort of strange times. There are some websites there which have got some fantastic resources that are really, really helpful. Thank you very much, everybody. Thank you for listening.
Thank you so much, Amanda. That was great. We lost track of time because the content was so good. So honestly, don't worry. There was no way we were going to end the webinar or interrupt you. The content was fantastic. So thank you very much.
No problem.
We've had some questions come in. I'm just monitoring. We've been Facebook Live as well. So we've had
I will do my best.
nearly 70 people on the Facebook Live, which is fantastic. And we have had a few questions in. So if anybody has any questions, we'll keep Amanda connected for a little longer. So do type them into the chat box. Some of the questions relate to, yes, this is being recorded. So if there's other slides that you want to go back on afterwards, then you will be able to access that during the recording.
I'll move it on to the BVNA helpful resources as well. So like I say, all of my slides will be, since we're recorded, they'll be available. If there's anything, like I say, if they can get in contact with the BVNA, and they can always contact me from there as well if there's anything.
Brilliant. So any questions that you think of afterwards, or if you're watching this live on Facebook and you're going back over the recording, do throw your questions to us either on Facebook or via email. Our email address is bvna@bvna.co.uk, and we will try and collate those and maybe have a blog post after the second webinar, collate those together. So bear with us a second while I have a look through the chat box. So I think some of the questions we may not be able to answer about specific products and situations. So if you have any sort of questions about products, I'd probably go to the manufacturers about them. Is that the correct advice there, Amanda?
So. I can't specify between. I've tried to avoid it all the way through, as people have probably
very well done.
So I would say to direct your questions direct to the manufacturers or the reps that supply those products as well, because they'll probably be really helpful and be able to guide you into the questions more specific on different products.
Super, thank you very much. And we've got some questions here, someone's asked advice for using in a grooming salon or in a different situation. I think the advice is the same, really. Would it be for a grooming salon or any other sort of animal related environment? Is that right, Amanda?
Yeah, absolutely. There's no reason that these sort of disinfection protocols can't be related outside of practice as well. I think it's really important that they probably are implemented into other places now. It's not just a clinical area anymore that this is a concern. It is now extending outside into the wider kind of general public sort of areas. So absolutely, I do think it's important for these kind of places, like you said, like grooming parlours or kennels, to again reiterate, making sure they've got these written protocols and sitting down and just putting them together with the team that they've got there, and again making it work for them. Again, it's not going to be maybe as rigorous as we are in practice, but again, it should be as close to as possible, really.
Yeah, brilliant. Thank you very much. And oh, sorry, we've had some. I was just reading something and someone wrote in another question and it disappeared. Bear with me. Sorry about the silence, and the cogs are turning as I'm trying to read and using my brain. Again, so some of these questions we're being asked to disinfect dogs on collections and drop-offs, and what should be used. So and yeah, a few of the questions are about because you mentioned that pets could be fomites. So what's your advice on if any on how we can disinfect pets that are being transferred between owners and staff?
Sort of like I mentioned, really there is minimal evidence into them whether they actually are a fomite risk or not. So there isn't a lot of evidence available, unfortunately, as to any protocols for whether we should be washing them down or whether we should be using specific wipes or things. I think really we have to be cautious, maybe especially with sick animals. I don't really think it's probably going to be, sort of advisable to be bathing and washing compromised animals that are coming in, and how realistic is it really that you're going to be able to effectively wash and deal with every patient that's coming in and through. So I think really it's going to come down to good hand hygiene and good handling of those patients. So wearing the appropriate PPE, which again we'll go over more in the second webinar, and just ensuring once you've handled that patient that you're washing your hands, you're cleaning down the surfaces and everything that you've used in between, then touching the next animal. So I think it's more just minimizing the risk rather than actually kind of cleaning down the dogs and cats themselves, because then you've got to think about how stressful that must be for them as well, being sort of pulled around too. So I think until there's more evidence, really it's going to be coming down to how you handle the way you handle them.
Yeah, perfect, thank you. And that sort of thing can be included in the checklist and your protocols, so that it's done the same for every animal every time.
Exactly.
Awesome. Okay, another question here, if I may, which is how often should door handles, etc., be cleaned and disinfected per day? Does that go again to looking at your cleaning audits and protocols, really?
Yeah, exactly. And I think it depends on your traffic. How many people have you got in that practice that are going through each day, and where it is? I would say in a high traffic area, as often as you can. In areas maybe where people aren't using it, you might get away with sort of once or twice a day, just an end of day wipe down, sort of staff rooms and things like that. You might just be able to just do a end of day wipe down. And again, as long as people are abiding by really good hand hygiene, it shouldn't be as much of an issue in lower traffic areas. So yeah, again, it's going to depend on, I say, how big a practice you are and how many people you've got in and out of there.
Brilliant, thank you very much. Alex, have we had any questions come in on the Facebook, or is there anything you want to add or ask?
Yeah, hi. We do have a couple of questions. Some of them I think we've already covered, if I'm going to be honest. So people asking about fur again, transmission via fur, but we've sort of covered that already, haven't we? Because there's little evidence really out there at the moment. Yeah. One person has mentioned about transmission via the fecal oral route, and is that something we should be concerned about? But I guess, I mean, I was thinking that you just need to adhere to your strict kind of hygiene sort of protocols anyway with that.
Yeah, absolutely. It's going to be no different to any of the other transmission routes. Again, that's actually going to come even more under hand hygiene and personal kind of hygiene than it even is, again, environmental, because the way you're going to pick up via the fecal oral route is it's going to be on your hands. So yeah, absolutely, just hand washing, which I will probably bash into everybody on the 27th.
I do have one other question. Somebody has asked, how many times a day would you recommend cleaning high touch areas?
Again, that probably comes back to the same as door handles, and how frequently they're being touched. So I would say your own personal equipment, if you've been the only one using that all day and nobody else, you haven't handed it around to the vets, they've not come and stolen all your pens and scissors, then cleaning them at the end of your shift should be fine. Any kind of communal equipment, like your otoscopes, communal stethoscopes, you know, I would actually be encouraging to try and stick to your own equipment all day, but if that's not possible, cleaning after use. So as soon as somebody's handled it and it's been in contact with an animal or another member of staff, just cleaning it and not assuming that somebody else has cleaned it. That's also important, just not assuming that. Again, it comes down to visual cleanliness. Just because you look at something and it's not contaminated and covered in, say, feces, it doesn't mean that it's clean. So just maybe even considering cleaning before you use something and at the end of using something.
Yeah, okay, thank you. Someone's just popped a question in here, but I think this is probably a whole nother webinar, if I'm honest.
Oh God.
How should we deal with a COVID positive owner? I mean, there's guidelines out there for that already, isn't there?
Yeah, absolutely. Yeah, I would probably direct them like to the RCVS guidelines and the BVA guidelines. As the next webinar, I'm going to be touching a little bit on having those patients in. But yeah, I think there's already guidelines in place there. So just take a little bit of time to go in and have a quick look on their websites and just familiarize with exactly what they're recommending, really. Because yeah, again, I think that could probably go on for a little bit. And again, it's all going to come down to what PPE you've got available and how you're handling it, and yeah, your practice.
Individual to a certain degree, isn't it, with some practices as to
yeah, exactly,
what they're going to be doing. Yeah, okay, thank you. That's all the questions from Facebook.
Awesome, thank you very much, my glamorous assistant Alex, checking the Facebook for me. So thanks so much for that, Alex. So I think we've gone through most of the questions now that have come in. Don't forget, everyone, to register for the second webinar that Amanda has kindly agreed to do for us. You can get registration details on our Facebook page and on our website, on the events that are coming up. As you leave the webinar, there will be a survey that comes up. It's really important to us that we get your feedback, please. So do spend just a few seconds ticking the survey questions so that we can find out when the webinar, best time for the webinars, the best topics, what works well and what doesn't. The BVNA is there, and we're providing this service for our members and also the wider profession in the current climate, the situation we're in. But it is important too that we deliver what our members need. So please do fill in and give us your feedback. I think that's everything from me. Thank you so much, Amanda. We've had some lovely comments in.
Lovely.
I think one of them, what date is the next webinar? I think that says, is it the 27th?
Yeah, the 27th. So I believe there's another one next week. I'm not gonna.
There is. Every Wednesday is the webinar at the moment.
So it's not next Wednesday, it's the following, so the 27th. So yeah, I'm glad everybody enjoyed, and I hope it was helpful. So
the comments here, great topic and very informative. Thank you, very helpful, informative. Thanks for your time, helpful information. So yeah, really some great positive feedback. So thank you so much, Amanda, for giving up your time this evening and in advance in 2 weeks' time. Thank you very much, Alex, for joining me and helping me with the techie side of stuff. And thank you all for joining and all the positive feedback. And we'll see you next Wednesday, same time, for another BVNA webinar. Thanks, everyone. Bye for now.
Thanks. Bye-bye.
Thanks. Bye.